www.healthcmi.com. Acupuncture continuing education online. Today, acupuncture heals bed sores. Find this article at the news link at healthcmi.com. Researchers find acupuncture safe and effective for the treatment of pressure ulcers. Those are bed sores. In a controlled study, investigators demonstrate that acupuncture significantly enhances the rate of positive patient outcomes for patients receiving standard wound care for pressure ulcers. Patients receiving acupuncture plus standard wound care had an 88.2% total effective rate, and patients receiving only standard wound care had a 70.6% total effective rate. So that's approximately an 18% improvement. So this is very common when patients are hospitalized for a long period of time, or in a wheelchair for a long period of time, or immobilized, can't get in and out, can't get exercise, can't get walking and moving and turning from side to side in one position. The pressure ulcers will occur. They can be very dangerous, and very severe infections can ensue. So wound care is very important in these situations, and acupuncture really helps these patients. Visit healthcmi.com to learn more how acupuncture prevents and treats this problem. Now, if we take a closer look at this article, licensed acupuncturists will be interested to see that there's several different modalities applied here. The TDP heat lamp is applied. Standard turtle style, surround style acupuncture is applied with electroacupuncture added, and even fire needling is used. I suggest that fire needling may not be required in this situation. Oftentimes, an acupuncturist will apply the needle directly to the wound without fire needle and get very similar results. But the way I see it, at the heart of this treatment really is the surround technique. 4 needles, approximately 1 centimeter away from each part of the region surrounding it. So imagine a circular lesion. So imagine 4 corners to that circle, if you will, make a box around it. And then on the healthy tissue is where you needle towards the needle, or what we call turtle style, and then adding electroacupuncture, swirling around that. That stimulates the chi and blood circulation, or we say in Western medicine, of course, microcirculation enhancement, which helps clean the wound and helps tissue healing occur very quickly. So that's something that is pretty much standard for an acupuncturist to apply. So no big news in terms of the clinical approach to care. What's nice is that it's quantified as a very successful method for the treatment of bed sores. In my own practice, I've seen this many times. I've seen cases where even young people were facing the removal of a limb amputation I've seen elbows, ankles, everything. A few examples. One patient injured his elbow during work activity, and it had not healed a year later. Wound care kept it from creating sepsis, kept it from severe infection, but it was still draining and oozing. It was quite bad. It was a young man, very healthy. However, wound care was not enough. In fact, I see the patient said, "I don't know what they're doing. It's not right." I said, what they're doing is right. It's just not enough to stimulate wound healing. And indeed, he had that area behind the olecranon, and an area, near the elbow, where wound healing is very slow. So a simple application of electroacupuncture, the turtle style, the surround needle style around the wound, helped close it up. In a few weeks we were done, and that was the end of it. Cancel the amputation. He was quite happy. I have run into him and his family several times since then, and he always seems so happy to see me, of course. So, but this, again, is not just something I do. This is standard. Most licensed acupuncturists worldwide, this is a very basic procedure for them to apply. So while it's not widely known in a lot of wound care circles, indeed, it is commonplace for acupuncturists to be able to achieve this level of result. I remember a young soccer player came to me with a bone plug. She had injured herself, a divot in the lawn, had hurt the ankle, for example, and the tissue started to necrose. They removed the bone in the ankle, replaced it with a bone plug. It kept failing. It had been replaced 3 times. She was facing amputation. They said it could go gangrenous potentially over time. They can't keep trying this. She was desperate, quite athletic. Great example. So again, standard acupuncture around the points. It healed up nicely. I said, the bone plug, I think they did a great job. She was critical of the surgeons. What are they doing? Blah, blah, blah. I said, you know what? I think they did a great job. The problem is they fixed the problem, but now your body has to heal. And sometimes there are autoimmune responses. There are rejections of surgical procedures, especially when new parts are installed. That's where acupuncture shines. The surgeon did a bang-up job. The question is will her body react properly? It's a lot to undergo surgery. It's intense, and the body needs to accept it. Again, that simple surround-style acupuncture around the bone plug, and off you go. She was quite happy. So again, the results are big here, showing approximately an 18% bump in effective rates here. But keep in mind that a licensed acupuncturist is typically fully capable of doing something very standard in the acupuncture circles. Keep in mind that with sports medicine, with wound repair, acupuncture is a mainstay, even in professional athletic teams. I think the San Francisco Giants, the baseball team, has had a team acupuncturist for something like 30 some odd years. There was a pitcher who wanted to trade to the Yankees but refused to go until the Yankees took on a full-time acupuncturist to travel with the team. So the Yankees signed on a full-time acupuncturist. And if I was a pitcher, I certainly would want someone working on my shoulder to be able to throw a ball at 100 miles an hour. I think if I threw a ball myself at 100 miles an hour, I think my whole arm would go with the ball. That's pretty incredible feat. And these people do it repeatedly, inning after inning. Acupuncture really helps prolong a career. In fact, that's what Randy Johnson, when he was still playing, I think, age 42 as a pitcher for the Giants, said that acupuncture twice a week helped prolong his career. The same was said of Morgan Anderson. I think he was, 49 when he retired from football. As he was a kicker, of course, punter. And he had acupuncture twice a week on his leg. I know that Stephen Curry even recommended to Draymond Green when he was having issues to try acupuncture because he likes it. So again, acupuncture for wound healing and for structural musculoskeletal repair is well suited for these conditions. So again, visit healthcmi.com. Take a look at this article, Acupuncture Heals Bed Sores. Now keep in mind, if you're in a modern hospital, a lot of the beds will move subtly. There's a very subtle movement. What is that? That's so that bed sores don't develop. There are specialized hospital beds where they might vibrate a little or move just a little bit here and there. Very interesting stuff. What happens when one goes home and they're in a wheelchair for an extended period of time? They may not have these fancy electrical devices to subtly move them around. So bed sores can be high risk in that situation. It's something to be monitored. And then what to do once they occur? Here's an answer. Here's something that really could help improve patient outcomes and prevent a disaster from happening. So for healthcmi.com, thank you for listening. If you like what we're doing here, please leave a review. We'd love to hear from you. www.healthcmi.com.